Hey, everybody, this is Dr. Ruben Valdes, Clinical Director here at the Thyroid Place. And as really a result of request and petition, I am now committing myself publicly to begin to post content. So many of you and many patients here in the office have been like, Dr. Valdes, you're not posting content. We want you to be out there talking about these amazing things that the Thyroid Place is doing. So here we go. So the first of these series is going to be on thyroid nodules. This is something that we get a lot of questions about and a lot of calls about, people trying to figure out what can be done with these thyroid nodules. So let's take a minute and go through some of the content. So the first thing is understanding that there are many types of nodules. They go kind of from less problematic to potentially very, very problematic. There are, number one, cysts. There are three types of cysts. One of them is called a colloidal cyst, which usually these are going to be some type of fluid-filled type of cyst. There are simple cysts. These are when little arteries in the thyroid rupture and there's a microbleed inside. So those are usually full with blood. And then there are some that are very concerning called adenomas. These tend to happen when the tissue that produces thyroid hormone becomes hypertrophic and it starts overproducing thyroid hormone. These are frequently some of the ones that may become cancerous. There's also something called a multinodular goiter. These can either come from certain nutritional deficiencies that would cause the thyroid to goiter or to develop multiple nodules. There are a couple of things that can cause that. We'll go over those in a minute. And then inflammatory nodules. These are most commonly seen in Hashimoto's thyroiditis. So these tend to be by far the most prevalent in the population. And they can either be transitory with a transitory period of inflammation, or over time, they can become more and more permanent. The causes for these thyroid nodules, understanding the root cause of them, and then being able to understand the difference between something that's benign and potentially treatable or shrinkable versus something that has already become malignant or problematic, in which urgent medical and surgical attention becomes primary priority. So there is chronic inflammation of the thyroid, what's called thyroiditis. Again, the most common cause of this being Hashimoto's thyroiditis. The infiltration of the immune system and the active destruction of that tissue can cause nodulation. Key nutritional deficiencies like iodine, which is the one that most people know about. Again, very uncommon in the modern world, typically more endemic in third world countries or places where salt is not yet iodized, which is really rare. But they can also be related to selenium, and also vitamin D deficiencies have been linked to the development of thyroid nodules in the thyroid. Certain infections have also been correlated to the development of thyroid nodules. Amongst these, H. pylori, chronic H. pylori in the stomach, and also a specific parasite called blastocytis hominis have both been linked to the development of thyroid nodules. Toxins, huge topic, and really there are a plethora of toxins that have been linked to the development of these nodules in the thyroid. But amongst them, there are things like mercury, cadmium, aluminum, lead, ferritin deposition, and even certain trace minerals that can be found in healthy foods. So something called oxalates. Some people have issues removing oxalates from circulation. These can actually accumulate and nodulate. Also, another one very common is products derived from petrochemicals that may accumulate in the body, are frequently stored in fatty tissues, the thyroid included. And then hormonal changes. This is actually an extremely prevalent form of causation for thyroid nodules, and yet it's rarely ever checked for, rarely ever tested. And the most common culprit is estrogen. When we talk about estrogen dominance, and in reality, what happens to many patients is that they have an issue detoxifying their estrogens properly, and they may bioaccumulate estrogen metabolites that will then drive hypertrophic changes in tissue. So estrogen makes things grow. That's why it's such a problem for cancers, breast cancers, and uterine cancers. So the thyroid is not no exception. There is a metabolite out there called 16-hydroxyestrone, and it has been linked to the development of these thyroid nodules. So traditionally, how are they managed? So one way is, if you have a high TSH, suppress the TSH with levothyroxine and Synthroid. So in many ways, it's effective in preventing a nodule that has the potential of becoming cancerous, those cystic nodules that can become cancerous, to keep them at bay and keep them controlled. Another one is just observation. So one of the things they do is they just keep watching them and watching them for growth every year, sonogramming them once or twice a year. And in my opinion, not a very convincing strategy. And then lastly, when things go south, these things frequently get taken out. So there are a lot of things that can be done effectively to help people shrink or at least reduce or stop the growth of nodules that may be benign, that may not be of the aggressive, nasty growing kind. Okay, so one of them is addressing chronic inflammation, and and just making sure that those things are eliminated, correcting nutritional deficiencies, addressing and treating infections in the body, removing toxins through detoxification, improving estrogen clearance in the body are all things that can be really, really beneficial. So in our diets, eliminating antigenic foods, so foods that you already know you may be sensitive to, or going out and getting a good food sensitivity panel, going through elimination provocation, and also removing the more commonly offensive foods to inflammation. Things like gluten, dairy, soy, grains, sugar, all can be playing a role. Detoxification, there's different ways of doing this. We believe there are some that are actually way better, more effective than others. Treating infections, so sometimes that may be an antimicrobial, sometimes an antiparasitic, correcting those deficiencies of selenium, zinc, and with iodine. Be very careful, be very mindful, make sure that you are working with somebody that knows what they're doing, because for those of you that are dealing with Hashimoto's thyroiditis, especially during an exacerbation phase, iodine may contribute to worsening your symptoms and your condition. So be very mindful that this is not cookie cutter stuff. This is just for informational purposes. I'm not giving you information to go out and treat yourself. Okay, this is just to create some awareness and understanding. And then lastly, balance hormones and clear those metabolites. For those of you that may have benign nodules that are growing, okay, so not malignant, benign nodules that might be becoming risky, and you may be in a place where you're being told that you may need a thyroidectomy, there is a really exciting treatment called HIFU ablation, which is a form of echo therapy or sound therapy that has been shown to, in a single session, reduce and at times even eliminate some of these growing nodules. So interesting alternative. And then thank you so much for joining us. Hope that the information is valuable. And if you found it valuable, share it. You may know somebody that's dealing with a problem like this. If you are interested in learning more about what we do and our work in all areas that involve the thyroid, visit us at thethyroidplace.com. There you'll be able to reach out, book an appointment, or whatever your need may be. God bless you. Have a great day.